In this video, I'm going to discuss a test item cluster for hip osteoarthritis. Hi and welcome back to Physiotutors. The cluster of Sutlive is a 5-item test cluster that can aid in the preliminary diagnosis of hip osteoarthritis in patients who complain of unilateral hip pain. While current practice is radiographic evaluation of joint space narrowing, presence of osteophytes, bony changes on joint margins, as well as changes of subchondral bone, according to the Calgary and Lawrence scale, the clinical prediction rule of Sutlive aims to reduce the need for such radiographs and provide clinicians with a tool to initiate early conservative management. According to Sutlive et al., 3 out of 5 positive items result in a positive likelihood ratio of 5.2. In case of 4 out of 5 positive items, the positive likelihood ratio rises to 24.3. The latter has to be used with caution due to the very large confidence interval ranging from 4.4 to 142.1. Furthermore, the clinical prediction rule needs additional validation, which is why we attribute a moderate clinical value. The 5 items of the cluster are: number 1, a positive hip Scour test. With the patient lying in supine position, passively flex the hip to 90 degrees. Move the hip towards the opposite shoulder and apply an axial load through the femur. Assess the patient's symptoms in the groin. Then move the hip into internal rotation and axial compression, consequently moving it into adduction and compression. Again, assess for the patient's pain in the groin or any other symptom reproduction. Number 2 is passive hip internal rotation less than or equal to 25 degrees. To assess internal rotation, the patient lies in prone with the hips in neutral position. Flex the knee of the affected leg to 90 degrees and hold an inclinometer just proximal to the lateral malleolus, and then perform maximal internal rotation of the hip. Maximum ROM is reached once the contralateral buttock begins to rise from the table. The 3rd item is that the patient reports hip pain when squatting. Number 4 is active hip flexion, which causes lateral pain. And at last, number 5, active hip extension also causes hip pain. Okay, thanks for watching this video on the cluster of Sutlive. Want more? Then check out various other hip assessments in the playlist on the left. Please give this video a thumbs up, share it and subscribe if you haven't. It really helps out our channel, and if you want to know about other ways to support our channel, just click the info icon in the top right corner or check the links in the video description. As always, this was Andreas for Physiotutors. I'll see you in another video. Bye.